Thank you very much. Good morning, good afternoon, good evening, wherever you are in the world joining us here. And of course, those of you that will look at this at a later stage, we've come together here to discuss the geopolitics of health, an issue that is coming to the fore in our discussions more and more in global health, but also in geopolitics. Some of you might have heard the speech of the German Chancellor yesterday, and it was quite extraordinary what a significant part of his presentation was on global health issues in the relevance for German politics, but also for G7 politics. So I welcome you to this discussion on behalf of the Global Solutions Summit, but also on behalf of the World Health Summit. We are doing this together, and two of us here are from the World Health Summit. We're the co-chairs of the World Health Summit Council. And I will introduce all the speakers to you now as we move forward. We have a group of very distinguished people who are involved in this in a variety of ways. First of all, we will have a keynote from David Fidler, who is a Senior Fellow for Global Health and Cybersecurity at the Council on Foreign Relations in Washington, D.C. And thank you very much, David, for joining us. We know your health and the health of your family isn't in the best way at present. So we are really very, very thankful that you have come to share your thinking with us. We then have Dr. Assi, who is with us as the chair of the board of the Kofi Annan Foundation, but is also co-chair of the World Health Summit Council together with myself. We have with us at short notice, and thank you very much for joining us, Professor John Curtin, who is a professor of political science and has founded the G7 research group at the University of Toronto, and has been following G7 in a whole variety of ways. And we hope to hear from him how geopolitics has played a role, particularly since the G7 has started discussing health. And any minute now, Dr. Stephanie Seydoux will be joining us from France. She is coming out of another meeting of the Global Fund for AIDS, Tuberculosis and Malaria to share with us the positions of the present French presidency of the European Union. So we hope that with these elements, we'll be able to highlight some of these ideas around geopolitics and health, and that we can take this forward also in the context of the T7 group. I am also co-chair of the T7 here at the Global Solutions Summit, and David, as he speaks to us, will partly be referring to a policy brief that he produced for the T7 group, and that will be made available to a larger audience soon. So welcome to all of you, and hopefully Stephanie will join us soon. And David, over to you for a short keynote. Thank you very much.
Thank you, Ilona. Can everybody hear me? Is it good? Okay, great. Thanks again to Ilona and to the Global Solutions Summit and the World Health Summit for inviting me to participate in this session. We're here to talk about geopolitics, global health, and the group of 7. And the main reason why we're doing that is we're trying to reflect on how geopolitics affected the general response to the COVID-19 pandemic, as well as the responses of members of the G7 and the G7 itself, particularly if we think about the G7 2020 and 2021 summits. And this impact, I think, is forcing a reckoning on the future of global health in a geopolitical world. And this reckoning clearly includes the G7 and its activities on global health. And at least from my perspective as someone who's been working in global health for a number of years now, this reckoning is new. I have to say that during most of the post-Cold War period, when we worked on global health issues, we didn't really have to think about geopolitics. We didn't have to think about competition in the balance of power or ideological competition. And so for us, it's a new feature of this. I also think that if we cast our minds back to the Cold War, international health, as it was more commonly called at that time, also was not an important, significant issue in the geopolitical competition between the United States and Soviet Union and their respective allies. And as we think about this new context as part of this reckoning, I just want to share what I think are 4 lessons that the pandemic teaches about the relationship between geopolitics and global health. And as Alona indicated, I'm taking these from that policy brief I wrote for the T7 process. So let me just walk through those 4 lessons quickly, and hopefully they can stimulate discussion and hopefully pushback on what I'm seeing coming out of the pandemic in this context. All right, the first lesson I think is that global health really achieved more political prominence in that post-Cold War period, largely because the balance of power and ideological competition did not define international relations in that time. And this really was the era of G7 global health activism. I mean, we can talk about specific things later, but this is really the time when the G7 became a major actor in global health. But I think we have to acknowledge that that political prominence that global health gained, as well as the G7 involvement in global health, did not prepare the members of the G7, or for that matter, the international community. It didn't prepare it for a pandemic, even though this had been predicted and warned for decades. And leaving aside geopolitics, that period has turned out to be something of a failure in global health terms alone. Second lesson, I think, is that global health issues, global health events can exacerbate geopolitical competition in ways that make international cooperation on health much more difficult. Again, we just look at COVID-19 as our example, but we could also look at how difficult geopolitics and the role that it played in how the G7 tried to respond in connection to COVID. And the difficulties the G7 had was often held up as a primary example of the failure of multilateralism or collective action during the pandemic. But even recognizing that, I think we have to realize that at least in geopolitical terms, global health is not strategic and fundamental, but it really constitutes an area of tactical opportunity. So we can have global health issues flare up geopolitically, create some reverberations in balance of power and ideological competition, but then they fade away again as the real drivers of balance of power and ideological competition continue. That flaring into the geopolitical context can certainly create problems for international cooperation on global health. All right, third lesson, it really follows from the previous lesson that foreign policy efforts on global health do not produce strategic benefits or advantages in geopolitical competition. The leadership that the G7 showed and that individual members of the G7, such as the United States, that leadership on global health was unrivaled during the period where China and Russia changed the balance of power and created serious ideological competition in world politics. And I think this lesson suggests that future G7 efforts in global health are not going to offer anything for G7 members concerning geopolitical competition. Fourth lesson, the way geopolitics affects global health highlights the dependence of low and middle income countries on the more powerful countries in the international system. And those countries, because of balance of power and ideological competition, are going to resist changing traditional models of development because development has once again become an instrument of geopolitical competition. Addressing that continued dependence and vulnerabilities of low and middle income countries might require a new non-aligned movement. But that in itself could agitate geopolitics even more and would pose challenges for the G7 in the sectors of health and development. Now, I think the invasion of and the war in Ukraine reinforces each one of these four lessons. And let me just quickly go through that analysis. First, the war has pushed COVID and efforts for future pandemic preparedness down the list of foreign policy priorities for G7 countries, as well as on other countries, I think, including China and Russia. Second, the war has hammered home that economic and military power matter the most in geopolitics. And this demonstrates that the geopolitical aspects of COVID-19 were simply tactical and opportunistic moments that are now fading away. Third, the war illustrates how little the G7's global health efforts before and during COVID-19 mean in the geopolitical competition that's now underway between the G7 members on the one hand and China and Russia on the other. In this context, for example, whether WHO member states negotiate a pandemic treaty doesn't even qualify as a sideshow in the geopolitical competition that's now taking place. Fourth, the war threatens to marginalize the needs of low and middle income countries in global health, and those needs were made worse by the COVID-19 pandemic. And the war also potentially reduces the prospects of changing traditional models of development to better suit the needs and the interests of low and middle income countries, which will prolong dependence and vulnerabilities of those nations. And then finally, for the G7, I think the war underscores that the geopolitical role it will play is anchored in those strategic drivers of geopolitics, economic and military power. And it is not going to encompass what it does in global health over the next decade and perhaps beyond. So I'll close there and turn it back over to Ilona.
Thank you very much, David. Thank you very much for those really challenging points that I'm sure will lead to some discussion with our panelists, and we'll of course bring you back in. We'll start with ACTE, very consciously with your voice, ACTE. You are speaking to us from Senegal, I believe. And I wonder how much you agree with David about, the geopolitics and multilateralism, because one of the issues he's not mentioned is the period of decolonization, for example, in the 60s and 70s. He did speak of a new non-aligned movement, and it is interesting how with Indonesia's viral policies, if I can call it that led to the PIP agreement, actually for a long period of time, for the first time, the non-aligned movement was pulled into health again. And the third example maybe that I want to raise is the recent EU-African Union summit. Stephanie might also come back to that. That was heavily influenced by the politics and the choices that the European Union had made. And the African countries, if I read the statements correctly, said, we're not interested in a partnership with you if you are not willing to make changes in some of the policies you have in relation to trade, vaccine sharing, etc. So how does this look, this geopolitics and health, from an African perspective, Asi?
Thank you very much, Ilona, and thank David, for putting those very challenging questions. Partly, I agree. I think COVID-19, has revealed and exacerbated, some of these dysfunctionalities that we are seeing today. Is it a new feature? I don't think so. I think it started, a long time ago. Of course, in a world that is, more interconnected than ever before, whatever happens today, take a prominence, that may have been dormant before, or even when it happens, in other times, did not get the limelight. And then the kind of a publicity that we are seeing. Today, whatever happens, we are experiencing it live. It is a chronic of an announced war that we have seen unfolding in front of our eyes. So we saw it coming, we're not able to prevent it. Like many a times, in geopolitics and in pandemics, unfortunately, we see things coming, but totally unable to prevent them from happening, which is quite a sobering situation in which we are. Why don't I think it is a new, future? So we can go back all the way back, to decolonization, like Ilona said. But let's take earlier, HIV/AIDS in the 80s, and then 90s. So there was not those things, that were kind of a global, in health, that we are seeing rich and poor experiencing the same, issues, of vulnerabilities, because of, the very nature of the transmission and how it impacted people. And also surprised us all at a time where we did not have, the arrogance of giving a pill or giving a vaccine, but having, to learn new ways of looking at it. So way before I know you, Ilona, I heard you say health is a political issue, long time ago. And I think for the first time ever in the history of international relations and in the UN system, an issue that is not directly, to security of war was discussed in the Security Council, and the famous resolution of 1308 of the Security Council, bringing together health and security and geopolitics, was triggered by HIV. I was hoping that something similar would happen during COVID-19. It did not happen. It did not happen. The Security Council did not, meet at time. We did not have a special session of the General Assembly on COVID-19. Despite the fact that we are portraying it as one of the biggest, pandemics of our time, and that is also being looked at, from a geopolitical lens. So what we've learning, I think, through times, we've said it in the GPMB that where Ilona and I were sitting, that we tend to get into the cycle of panic and neglect, and then we tend to forget, when things subside, that we've been there, and then the lessons that we were learning, could be applied again. So a number of issues are related to geopolitics, of course. Governance, local governance, but also global governance, leadership, at all levels. I think I'm sorry to say, from my perspective, that we've been experiencing a breakdown in governance, a breakdown in leadership, that would be bringing actors together so that geopolitics are not seen as a problem, but maybe part of the solution. That is a very sad situation where often geopolitics, instead of being the solution to the problems, often at times, is coming to be, the problem. Now, the real question and answer will be, how do we move geopolitics from being the problem, but rather part of the solution? And let me just say 2 words here from the Global South and then from the country I'm in. Honestly, there has been some kind of a disillusion in global solidarity, disillusion in multilateralism, disillusions in global politics, because of the many promises made and then not being delivered upon, which is again a breakdown in leadership and accountability and good governance. And COVID-19, has shown that. And we've seen it, with vaccine, so-called vaccine nationalism or egoism. We've seen it in hoarding of PPEs and hand sanitizers and then masks, all of that, while at the same time we all keep on repeating none of us is safe until we all are. But in practice, it did not happen. So what we are seeing now is that some lessons are being learned from the Global South. And I think this kind of a so-called non-alignment or new non-alignment, that is really not new. And it is not also by chance that Indonesia is being active in that. We can all remember Bandung, that is not yesterday. It was not during the pandemic. It was not, during HIV. It is way before that. And I think some of those lessons, those situations that were dormant are being now awakened. And I can tell you, for example, when you say, David, that because of the war in Ukraine, so COVID-19 may not be really the priority of the day. In Africa, it is during the war in Ukraine that I think people have been more active on COVID-19 than I've ever seen. I'm seeing now, more than ever before, an acceleration in local production of vaccines, an acceleration, in the establishment of the African Medical Agency, an acceleration in the regulatory bodies, so that a certain sovereignty derived, from the lessons, learned from COVID, can happen so that we do not always be last in the queue when some of those shocks and hazards happen. And that kind of a non-alignment also is really reflected also in the political reading of the war in Ukraine. When politically, you can just look at the votes in the General Assembly, and in most of the African countries and in most of the countries of Global South have either abstained, or they did not simply participate in the vote, in fact, condemning it. It does not mean that they're encouraging Russia, with the exception of Eritrea, maybe, but I think people are also learning to look into their own ways of making sure a certain sovereignty exercise, so that the answers to one's problems, are being seen. What does it mean now for, I think, G7 and all the other grouping looking in this particular situation? Well, partnership is key, and it should not be words only. It should be exercised, in real activities and real terms. What we're saying, it is not in the middle of a crisis, that we will be building trust. It has to be happening before, it has to be happening during, it has to be after. And that means, again, we need to get out of the cycle of panic and neglect. I think there's a number of lessons that we can learn there. Some of them you have highlighted, but I think we need to kind of align that with all the other ones, before, but paying particular attention, to what we're experiencing now, and then not, of course, forgetting the fact that the impact it is having beyond pandemics on food security, for example, that again, coming back, to the sovereignty that is pretty much in line with the non-aligned movement or awakening that we're starting to see. Let me stop there, Ilona, so that we can come back later in the discussion on what can concretely be done by the G7 and how the G7 table can be expanded so that other seats, can be called upon so that we can have a global response to a global problem. Over.
Thank you very much, Assi. And for those of you who are not familiar with some of the alphabet soup, the GPMB is the Global Preparedness Monitoring Board. That has been jointly established by the World Health Organization and the World Bank, and has issued several very critical reports on pandemic and response. And Assi has been the co-chair of that. I think also it's very interesting, Assi, that you remind us of Bandung and the discussions and the recommendations from there, basically the paradigm that was presented there, and that got lost in everything that followed. So I think that's a very, very interesting point, and the fact really how much Ukraine impacts other activities. And that sort of takes me to Stephanie, because it's also what was highlighted by Chancellor Olaf Scholz yesterday about the significant funding, for example, of Germany in this case for the ACTE accelerator, which is 1.3 billion actually, which is investment financially in production capacity in the Global South, Africa in particular, plus some other issues. So at least monies that have been spoken seem to be moving. Whether there will be new money, that's the kind of issue that also David raised. But Stephanie, if I look at the European Union, and we have the French presidency, we have the statement by Mr. Borrell, the High Representative of the European Union on Foreign Affairs and Security Policy, who says, we see the birth of a geopolitical Europe. Many commentators have also said that, and that the French foreign minister when he was speaking after the first meeting of health and foreign policy ministers that you will probably speak to us about actually said health is geopolitics. So taking the extreme other view from David. So I wonder if you want to tell us a little bit about, how the French presidency sees the role of global health and its links to geopolitics, particularly for Europe.
Well, thank you so much, Ilona, for a great question and a great discussion so far. And well, to your question, let me start from a little bit further from the field and say that France definitely has a vision of health as a global matter. So we do have a notion that health is global, or said in other words, a vision of global health. My title is Ambassador for Global Health, and I've had many predecessors, so it's been standing for a while. What does that mean? Well, we were shaken like everybody else. I'm not saying that we were better prepared, not at all, but definitely, and this was said earlier, the pandemic, which we all went through, I mean, what more bitter and better demonstration that health is indeed global. It was fueled by our global planetary interactions. No single country was able to protect itself. No single country was able to defend itself and or deal with it on its own, despite the fact that, of course, each national government has its primary duty, and responsibility and accountability to its own population. So global. Then, of course, before the French presidency started, we were a year and a half, almost 2 years into this COVID pandemic, where with others, and clearly with Germany and our other European partners in particular, the very early, well, maybe not early enough, but early on, at least after the pandemic was declared, there was a sense we were not prepared, of course, panic and neglect. Absolutely, we had been negligent. But when things became very urgent, it was clear that there was not going to be any valid response to this if we were not going to be able to at least act collectively, and that's what gave rise to the ACTE mechanism. Many people were proposing different mechanisms. Many organizations were willing to get into action. It was important that this was not only a collective initiative or mobilization, and a crucial part of that was that it had to be around the WHO, involving all the other very major players in global health, such as we call them the vertical funds, Gavi, Global Fund, UNITAID, CEPI, others, and also definitely with principles. This wasn't only about finding vaccines and then trying to buy them. There had to be a global public good equity notion to this straight from the beginning. We saw that in the first months, at least, it probably didn't look like it was going in that direction. But some countries, France was amongst them, or players, were very insistent that the ACTE was really about access, i.e. equitable access, and had to include all countries, all players, although obviously in the unraveling of what then happened, it took some time before all the voices were able to be heard. So this is, I guess, where we came from. The French presidency definitely set as a proposal, because again, a presidency of the European Union doesn't entail that the country that is president gets to put forward its own priorities, but it's proposals that are made to others. And we really wanted to make that offer, and it was a very satisfying thing to see that it had been taken up on two aspects. One, indeed, as you said, Ilona, is to recognize the geopolitical significance of health, and I'll get back to that. And that was the meeting which was held in Lyon on the 9th of February, gathering ministers of health and ministers of foreign affairs. It was an informal meeting of the 27 countries of the EU, and it was a first. And then another one that took place the next day in another place, Grenoble, not far, and that one more about the way forward to build a European Union of health within its own ensemble, but connected obviously to the external role of Europe in terms of being a player on the global health scene, as it were. Now, these might seem like very pompous words and very general, but it's astonishing the degree to which it actually was, it made a difference to have that discussion. It was, as we say in French, it had been until then, in both cases, the external and the sort of general Europe of health, an impensé. It was something which hadn't been thought. It had remained at an implicit level. And those two meetings actually revealed an incredible appetite and a lying consensus, or an underlying consensus to move in those directions, which was, I have to say, I mean, I've seen many meetings, quite spectacular. So in the first meeting of the foreign affairs and health ministers, well, basically, the whole purpose was to take stock of what was already being done by the Commission and by each single member state, among which incredibly involved players such as Germany and others, and to agree to continue a strong, an already very strong involvement in the COVID response. It was established, for instance, that Europe had been the most, as an ensemble, the first exporter of vaccines, had never put any barrier to the export of doses of vaccine worldwide. Very, quite significant numbers, 34 billion then in February, had been contributed globally by Europe to the COVID response. And there was also a commitment, so there was a commitment to continue, having realized that this was going to continue, having a strong global health strategy, one of solidarity, one of partnership, to support low and middle income countries in their response to COVID by continuing to promote equitable access to health products, as ACTE in particular, to confirm the role of the European Union in strengthening the multilateral health architecture with WHO at its center, and to integrate the One Health approach. And I'll get to the African Union and EU.
Stephanie, you have 1 more minute. We
Sure.
have to rush a little bit, please.
Okay, so I won't go into the other summit, but simply to say, maybe I haven't specified it earlier, that what was quite powerful on the Europe of Health one, the one that took place the next day with only ministers of health, is that they agreed on, it appeared self-evident that Europe needed to commit to a European Union of public health, and that's the most important word, public health. And as you may know, health isn't a competency of the European Union, so huge avenues there for cooperation. Can get back to that later. African Union, European Union Summit, as SC was saying, the main point there was that it's a partnership, and that both continents were happy to exchange on the need for sovereignty to be the key word going forward, and how partnerships could be built on that. So there was an immediate response to help the vaccination campaigns, a very strong commitment, you alluded to it, Ilona, in helping, or rather in building partnerships for production capacity in vaccines and treatments for COVID and more generally, and to enhance sovereignty, also the importance of addressing the health system strengthening dimension in a durable and above all shared vision. So this was the spirit. Of course, there are steps going forward. The G7 currently under German presidency. There'll be a closed door roundtable organized by Pandemic Action Network and the Paris Peace Forum, still under French presidency of the European Union in April. And we will, as a presidency and bilaterally as France, continue to address this or effort to put health as a geopolitical object as high as possible on the agenda. And I'm not even going back to what David Fidler has said were the huge challenges we're encountering at the moment, with a very worrying, obviously, security and defense situation in Europe. Thank you very much.
Thank you very much, Stephanie, for giving us that input, which seems to indicate that at least at present, even though some of the meetings you referred to were before the Ukraine war. So we will see how that is kept up, and we are hearing from you that that commitment is very high from the presidency. We have about 15 minutes left, so the way I want to spend them is first of all to ask John Curtin, who, as I indicated to you, created the G7 research group and has followed the G7 for at least a decade, to give us a short indication, John, you know, how has geopolitics played out in terms of global health in the G7? I would say in one case, yes, which is linked to President Trump. Maybe you come back to that. But if you could give us some indications, is this new, as David said? Has it always been there? Are we just noticing it more? If you could say a word or two, and then I'd like to ask David to respond to what he has heard from the others. Please, John. Just hold on a minute. We're trying to wait if we can hear.
Thank you, Ilona.
Yes.
The G7 summit is, I think, a central and necessary global health governor, because as my fellow Torontonian Brock Chisholm knew all too well, the first Director General of the World Health Organization, health is not just the absence of disease, but a full state of physical, mental, and emotional health. Social medicine, the social determinants of health. So it's not just the health ministers in ministry, you need the leaders. And from almost the very start, G7 summits have governed global health, and they've had some standout successes. One, the creation of the Global Fund, 2001. The other more recently, the 2010 summit, major advances on maternal, newborn, and child health. And when you look at the broader record, hundreds of commitments they've made, but they've gone back home and complied with them about 70% of the time. And one of the countries that's complied the most is the United States, whether it has a Republican or a Democratic president. And that's why, as Ilona, you certainly pointed to.
You've got to keep your hand down,
okay,
John,
sorry.
Otherwise we don't hear you.
Sorry, March 16th, 2000, Donald Trump was the host, an emergency summit as COVID was breaking out, and a number of big, bold commitments and extremely high compliance with them. So we would like the G7, now under German custodianship, to do the same thing, not only because COVID is still with us, but there are many other diseases it is leaving behind. The G22 has a pretty good record, not only in making health commitments, but in actually complying with them. So there's hope that that bigger, broader group can also do a big, make a big contribution. So we're looking at Bali. I'll end with, though, two things the Gs have not done and need to do. Everyone knows that there's an integral connection between climate change and health. And climate change was priority number one for the German G7 presidency. But they really do need to connect it with health and advance both together. The other one is mental health. Most of the G7 countries are aging societies, Alzheimer's, dementia on the rise, and the mental health burden from everybody, including the kids who've been locked down for about 2 years. Add to that what we're learning about long COVID in the brain, and most recently you can add what over 3 million refugees from Ukraine, all of whom are suffering from mental afflictions that they didn't have 2 months ago. So a lot we need our Gs this year to do.
Thank you, John, and sorry for the technical problems. I hope you heard most of what John said, saying that actually the implementation rate of the G7 has been extraordinary. And he even says that despite the difficult Trump years, a number of important decisions were taken in the G7 context that actually took us forward and were implemented as well. David, having heard from the three colleagues, how do you respond?
Well, actually, listening to the other, remarks reinforces my skepticism about global health's geopolitical importance. And I'll just touch on a couple of things. I know you want to get to comments. If we're seeing a rejuvenation, a revival, a return of the non-aligned movement in the nexus between the Ukraine war and COVID-19, the non-aligned movement during the Cold War was a geopolitical mechanism. So that suggests to me that the thinking is developing in the same way. My premise is that as that unfolds, other issues are going to be more geopolitically important in a new non-aligned or a rejuvenated non-aligned movement than global health is going to be. I'm not arguing that global health is going to disappear as an issue of collective action, but being an issue of collective action doesn't make it geopolitically important. In terms of the European Union's interest in these issues, both within the European Union and then potentially in connection with Africa, that raises lots of questions. First, is the European Union even really a geopolitical actor in the world that we're seeing today, or is it subordinate to what's happening between the United States, China, and Russia? Second, if the European Union is trying to get its domestic house in order, I'm not entirely sure what that means geopolitically. Third, the relationship with Africa involves far more than health. And there are some issues there, trade, economic relations, that might be far more important for the EU to play a geopolitical role with the African Union going forward. Yes, the G7 did lots of things during the post-Cold War period on global health, very active, very innovative. It was a leader. But when I think back on that period, we have 70% compliance with G7 commitments, and then we have the disaster that we had with the G7 and all of the G7 members during the pandemic. It's hard to be impressed by that compliance rate with G7 commitments in light of that. Secondly, the world has changed. We don't live in the world where the G7 showed that leadership, and I'm skeptical that we can continue to claim that activism on global health is going to have any geopolitical impact. I don't see any evidence of that from the Cold War. I don't see any evidence of that from the post-Cold War period either. that's part of this new reckoning. And I know we're all sort of trying to guess and speculate as to what's going to happen, but at the moment, I don't see a strong argument that global health is going to be significant in geopolitical terms.
Thank you, David. We have 5 more minutes, and I would ask each of you to just say, irrespective of whether we now define it as geopolitical or differently, if we look to the G7, and this is the context in which we are also discussing this, and having heard leaders like Olaf Scholz speak about it, what is, if there is one key thing that should come out of the G7 this year from the side of, the German presidency, what would you be expecting? And you really only have time for one thing, because they're very strict here about closing down. So Asi, what's your one thing you would want?
Well, the one thing is summarized, I think, in the word, partnership, a true partnership. And because the world is more interconnected than ever before, and I agree with David, times have changed. Now we live in a different world, and exactly because of that, I think global health will be remaining a global geopolitical issue, that needs to be addressed that way in a partnership.
Thank you. Stephanie, one thing. Please unmute yourself.
Well, from the French to the German, be bold. We want a strong, vocal, politically active Germany, affirming what we know is right as Europeans. I think the time for unabashed German leadership is in front of us politically.
Thank you for that, John.
I wish I could say that in German.
It's very difficult. It's very difficult to translate leadership into German. That's a dreadful word that we have. So please, John.
Because health is wealth, we will transform the WHO to become almost just like the International Monetary Fund in its funding, in its powers, but in its governance will go beyond the G7 folk to embrace the whole world, including, of course, Africa, HIV/AIDS, Ebola, and so much more.
Thank you, John. You have your bold statement here, Stephanie. Of course, we have organizations that encompass 194 countries that are trying to do that. So the question is, what is the specificity that the G7 could add? Any point from your side, David, as a closing?
I want the G7 to be bold on global health. I don't want the G7 to pretend and argue that that's going to have geopolitical significance. There are other reasons, other normative values and interests for focusing on global health. It doesn't have to be a geopolitical issue to be important to the G7 or the international community. But I do think we need to stop making the arguments about national security and geopolitics when we're talking about global health. There's no evidence to support that.
Thank you. And that takes us back to some of the old discussions we had, securitization of global health, et cetera, et cetera. And I think one thing you said that I'd like to leave with the audience and all of us is really critical, if I quote you correctly, I hope, is that an issue of collective action, being an issue of collective action, does not necessarily make it geopolitical. And I think we have to be very precise about that. I personally, but I'm just the moderator, actually do think there's more geopolitical stuff going on than you say. There's some people who asked about readings. I would encourage you to go on the website Think Global Health of the Council on Foreign Relations. There's several papers there by David where you can read on some of his positions. I said our working paper, the issue paper that he wrote, the policy brief, will soon be available. There's an article in the BMJ by myself and Anna Holtscheiter that couldn't join us today. There is things that John Curtin has, of course, written in the context of his projects. So there's a lot of literature out there. Please do read it. Also on health and foreign policy, there's a lot written on that. There is, John is holding it up, Health, a Political Choice, a series of books that have tried to look at some of these points. So 50 minutes is very short, I know. Thank you very much to the speakers. Thank you to the audience. Thank you for your comments in the chat that many of us have read. And we all know the importance of collective action in global health, of more equity, and of moving forward on it in G7 also as a truly high priority, geopolitical or not. Thank you very much for this. Bye-bye.